In my practice, one of the most common and misunderstood symptoms I see is a spinning sensation that people often describe as dizziness. Sometimes it is ignored, sometimes it causes immediate panic. Both reactions usually come from not fully understanding what the symptom represents. Today, I would like to explain what vertigo truly is, why it happens, why it is usually harmless at times, and when it requires urgent neurological evaluation. Understanding the difference is important for safety and peace of mind, as well as to navigate critical situations. Hello, I'm Dr. Prabhash Prabhakaran, neurologist with special interest in vertigo and balance disorders. And in this video, we'll break down vertigo in a very simple and clear way. So what exactly is vertigo? Let's first understand something very important. Vertigo is a false sense of movement. It's an illusion. You may feel that the room is spinning, or you are spinning, or you are tilting, falling, or there is imbalance, or you are being pulled to one side, even though nothing is actually moving. That spinning sensation, that is true vertigo. And this difference is very important because the treatment depends on the cause. To finding the cause, the history is very important. Now, the next question is, why does the spinning sensation happen? Your balance depends on few systems working together. Number one, vestibular system and its connections, which perceives motion in relation to the environment. Your eyes, which perceives what's happening around you. The third is the brain, which does two functions. One, it prepares the body for any voluntary movement, and the next combines all this information and then makes adjustment for maintaining the balance. And the brain compares all this redundant information, and when signals between these systems doesn't match properly, your brain gets confused. And that confusion creates vertigo or any sensation of imbalance. Think of it like three GPS systems giving three different directions at the same time. Your brain doesn't know which one to trust. So next, let's talk about most common causes of vertigo we see in clinic. Number one, BPPV, benign paroxysmal positional vertigo. This is one of the most common type. It usually happens early in the morning while turning in the bed, looking up, bending down. It lasts only for few seconds, but at times it can be very intense, associated with vomiting, and it causes intense fear. This happens because tiny crystals called otoconia inside the inner ear gets displaced into the canal, which senses angular motion. The good news, it can often be treated in minutes with specific repositioning maneuvers. One of the second most common is vestibular migraine. Many of them have headache. Some patients don't even have headache. They just have recurrent dizziness, sensitivity to light, motion intolerance. So this is migraine related vertigo, and it requires completely different approach. Third set of common balance disorders are functional balance disorders. There is no structural problem here. The information coming from multiple sensory modalities like from vision, from the balance system, from the nerves, all are perceived in the brain. In this, when there is a problem in this perception, people can have functional balance disorders. Many people with functional balance disorders also are little anxious. There are multiple types in functional balance disorders. One is triple PD, where the affected person should have dizziness or imbalance for at least 3 months, mostly in the evening hours. And there is visual motion induced instability. Also, it comes only when the person is upright, and also when there is a busy visual field, for example, like driving through a well-lit area or entering a shopping mall can intensely produce a dizziness. The next type is Debarquement Syndrome, where a person is traveling in a vehicle, and when the vehicle stops and he alights from the vehicle, he might feel the imbalance. The next one is Motorist vestibular disorientation syndrome, where while driving they can feel dizziness, and it can be very typical. They might develop it when they are driving through a highway. Certain people can develop it while they are driving through busy traffic, or certain people can develop it when they are driving through a hilly roads. Next is vestibular neuritis. This can present with certain severe vertigo, vomiting, difficulty in standing, needs support. This may last days. It can be very frightening, but it is treatable. Closer to vestibular neuritis is stroke and other neurological problems. So most vertigo cases do not require a scan. The vertigo is primarily diagnosed clinically, which means a thorough, detailed history, understanding the pattern of symptoms, specific bedside balance tests. All these helps us in diagnosing. In many cases, these tests clearly tell us whether it is BPPV, whether it's vestibular migraine, whether it's functional balance disorder, or whether it's stroke, or all those symptoms which we explained earlier. This is very important since we all know that stroke is a medical emergency, and on immediate treatment, the symptoms can be reverted. Symptoms like double vision, slurred speech, weakness, severe imbalance, vision symptoms, all these needs urgent evaluation. So when should you worry about vertigo and when should you consult? As a dictum, it's better, any new onset vertigo, better to consult. You cannot ignore vertigo if it is sudden and severe, if it keeps recurring, it lasts more than a few minutes repeatedly, also if it's associated with any neurological symptom which I explained earlier, or if it's affecting your daily activities. Many people ignore vertigo for months thinking it's just weakness or chalega. But balance disorders are treatable. The earlier we diagnose, better the recovery.